Hi, wellness friends. For this episode, let me share with you some risk assessment questions to assess your health situation right now and to look at future risks that may happen. Now, this had been developed by Dr. William Lin, a favorite online teacher and guru of mine and the author of the best-selling book, Eat to Beat Disease. Now, what we're going to do is to answer those questions. And based on them, there will be a scoring system. If it is a low risk, then you can put there 0. If it's a medium risk, you put there 1. And if it's a high risk, then you put there number 2. Now, this is basically not a predictor of any disease. But what it will show us risk factors, the dangers definitely of what may happen in the future, so we can do some preventive measures on it. Awareness basically, so we can make the proper action. Okay, so are you ready? Okay, now the first question is, how old are you? Okay, now basically diseases are very preventable, but as you increase in age, then there's also an increase in acquiring those diseases. If you are less than 30 years old, you put your score as 0. If you are more than 30 and up to 50 years old, you put there 1. And if you are more than 50 years old, you put there number 2. Okay? Okay, so question number 2 is, what is your sex? Now, basically, we're not going to put any numbers right here, but it will just make us aware that because of our sex, our gender, there is a predisposition for certain types of illnesses. Like, for example, for females, there is definitely a possibility as you age of acquiring breast, of ovarian, of cervical, and even of uterine cancer, right? And if you are a male, then there's a possibility of acquiring later on in life, as you age, of acquiring prostate cancer. So that's question number 2. All right. Now, question number 3 is, what is your body mass index? Now, this is a little bit complicated, but we can do this, okay? Now, there's a greater risk of acquiring all sorts of diseases like cancer, diabetes, and even cardiovascular diseases based on your body mass index. Well, what is a body mass index? Basically called a BMI. It is a measure of the fat in your own body, which is based on your weight and on your height. And basically the formula is this. We got it right, okay? BMI is a measure of the fat in our own body, which is based on our weight and on our height. Now this is the formula for BMI in kilograms and in meters. It is actually the number of kilograms that you weigh divided by your height in meters squared. Now, for example, if you are, let's take myself as an example. In kilograms, I weigh 50 kilograms. And in height, I am 1.63 meters. So I'm very short, right? Okay, now if I divide 50 divided by 1.63 squared, that comes to around 19.5 BMI. So I'm 19.5 BMI. Now, in our scoring, if your score is 18 to 25, you put there 0. Okay? You've got a good BMI. Now, if it is between 26 and 30, you put there 1. That's a medium risk. But if your BMI is over 30, you put there 2, meaning that's a high risk. Obesity is always equated with a high risk of acquiring a lot of diseases. So this basically measures the fat that we have in our own body. Okay? Now, question number 4 is related to past medical history. Now, if we have had diseases before and right now they are still active, then that is a predisposition for acquiring other diseases in the future. If you have been traumatized or have had other kinds of diseases like surgery, you have had surgery, then this one is not included. But if you have been hospitalized and if you have had prescription medicines in the past and even continuing right now, this is directly related to it. Okay, now also if you have had mental health problems like depression, having bipolar and schizophrenia, this is directly related to our past medical history. For others, please ask your doctor and also put there if you are active or inactive. Okay, now if you have got a clean bill of health, you have never been hospitalized, you have never had any mental ailments like depression, schizophrenia, then you can put the 0. All right, clean bill of health. Now, if you have had some past history, especially you have been hospitalized at least once, but after some time it has become inactive already, you put there number 1. Okay, but if you have been hospitalized more than once and the reason why you have been hospitalized is still active, you can put there the number 2. Okay, so we will end this episode with those first 4 questions. The next ones will be in the next episode so we can assess the risks that we have for any future ailments. With the 4 questions, my answer on the first one is actually 2. I'm above 50. In question number 2 is I am male, so I should be very careful about prostate cancer. Okay, and I'm very careful about that, my friends. Now, question number 3 is about body mass index. My answer there is 0 since I am within the safety range from 18 to 25. I'm 19. And past medical history, I've never been hospitalized for any ailments, for any chronic diseases. And so my answer there is also 0. So overall, in the first 4 questions, my total score is around 2. Okay, be prepared for the next questions in the next episode. So before I end, let me share with you a quotation from my favorite author, Dr. William Lin, and let me read it here. He said, and I quote, "The best way to make the world a healthier place is to start with yourself and the people you care about, and start eating to beat disease every day." Wonderful quotation from Dr. William Lin. And with that, let me tell you, my good friends, to please stay safe, stay away from toxins, especially in our diet, and stay healthy. And I'll see you in the next episode.